Hello friends, I am Dr. Shreya Krishna, your trusted oral and maxillofacial surgeon, and today we'll be discussing all about corrective jaw surgery, also known in the medical lingo as orthognathic surgery. So what are the common reasons for which patients get corrective jaw surgery done? The most common is if they feel their jaw is very long, specifically if they feel the lower jaw is very long. Second, if they feel their upper jaw is very protrusive, that means it's too forwardly placed. Third, if they feel they have a gummy smile, which means that when they're smiling, they feel too much of their gum is showing rather than their teeth. And the fifth most common reason for which patients come to us for jaw surgery is for facial asymmetry, which means that patients feel that their right side of the face and the left side of the face is not identical. So let's see what are the types of jaw surgeries offered. Just take a dummy skeleton to show you. So a jaw surgery is of 3 to 4 types. The first is when we are operating just for the upper jaw. We call it the maxilla. So what are the reasons or what are the candidates for an upper jaw surgery? It can be if you feel that your upper jaw is too protrusive. Maybe in your childhood or in your social circle, you may have been called having buck teeth. Now, buck teeth, as we have studied, is not always a problem of your teeth or your dentition. A lot of times you have that appearance of buck teeth because the problem really lies in your upper jaw, which is the maxilla. So you need a corrective jaw surgery for that. The other reasons why you might need a surgery for your upper jaw is if you feel that your face has a very flat appearance, it does not have the curvatures which make a face look beautiful, then in that case you might need to undergo upper jaw surgery in which we bring this upper jaw more forward. Third, as I mentioned earlier, if you have a gummy smile, which means that when you're smiling and too much of your gums is showing, it is indicative that maybe your upper jaw is too long, and in that case we just cut your upper jaw and we take it a few millimeters upwards. The second type of jaw surgery is your lower jaw surgery. This is called the mandible. Many reasons can be there for you to undergo a lower jaw surgery. Very commonly, a lot of patients feel that their lower jaw is too long, so it's projecting too much in front of the face. Second reason can be very converse to the first reason. A lot of patients may feel their lower jaw is too small. That means you have absolutely no projection of your chin or your lower jaw. Third, and again very common, is if you feel that your face, the two sides of your face are not identical or they're too dissimilar, then you might approach us for lower jaw surgeries. Now, sometimes we even do both jaw surgeries together, which we call as bi-jaw surgery. When might you need a bi-jaw surgery? So, if any of the reasons I just described are too severe in magnitude that we feel that a single jaw operation will not give us the desired result, we go in for a bi-jaw or both jaw surgery. Another subset of patients who might need bi-jaw surgeries are those patients who were affected with cleft lip and cleft palate during their childhood. They usually have such a high magnitude of some form of facial deformity that surgery is usually performed at the same time on both of their jaws. In some of the cases, we perform a jaw surgery not of the entire jaw but like a part of the jaw. For example, sometimes we do jaw surgeries only for the chin, which is this area, or sometimes maybe we do it only for the front part of either of the jaws. When would you be a candidate for a chin surgery? If you feel your chin is too small, too long, too short, deviated or crooked, then you are a candidate for chin surgery. When are you candidate for only the front part of your upper jaw to be operated? Reasons like gummy smile can sometimes be treated by only front portion of the jaw surgery. Sometimes buck teeth correction can also be done with just a partial jaw surgery. Now, after you have understood or after you have understood the requirement that you need jaw surgery, or you're curious to know if jaw surgery can enhance your face in any way, who do you really approach? So it's very simple. you visit a board certified oral and maxillofacial surgeon such as myself. So when you look for a board certified oral and maxillofacial surgeon, you must see if your surgeon has a specialization in doing such corrective jaw surgeries, which are also called as orthognathic surgery. Please do your research very properly, since most of these surgeries are completely life-changing. Now, when you have found your suitable surgeon in your city or likewise in a country, what do you expect in your consultation? Usually and preferably a physical consultation is opted for in such cases. When you do visit us in our clinic, we do a complete physical examination of your face. First, grossly, we see how the thirds of your face are proportioned. We see your side profile of the face, where we see how is your nose projecting, how is your upper jaw projecting, how is your lower jaw projecting, how is your chin projecting. We see a rough angle between your nose and your upper lip, of your chin with your throat. Taking these rough measurements forward, we go and advise you for some basic set of CT scans. Now these CT scans are then transferred onto our softwares, where we do a CT scan facial analysis. So in our practice, we have completely moved from conventional methods to a digital based clinical practice, so that we minimize the margin of error to absolute minimum. So once your CT scan is done, we take your dental impressions and we make dental models. It's very important in jaw surgeries to study and know how your teeth are related to each other, because they are great indicators of how our jaws are positioned, and also because after the surgery, teeth position become very important for recovery. Now once everything is done, your analysis is ready, and we know exactly how much of repositioning we are planning, we schedule a video consultation with you. We show you the results of our study, and we show you what is the plan for the surgery in a simulation surgery on the software itself. Once you are satisfied with what we have planned out for you, we go ahead with your jaw surgery. Now, what entails in a corrective jaw surgery? So, first of all, it is done in general anesthesia, and it is done to candidates who are found fit for general anesthesia, which is decided by our expert team of anesthesiologists. So the procedure usually lasts for 4 to 6 hours, depending on the kind of procedure we are opting for. If it is a single surgery, usually it is done in 3 to 4 hours. If it is bi-jaw, it can last for 6 hours. And if it is only a part of the jaw, for example your chin, then it is completed in 2 to 3 hours. This surgery is done from entirely within the mouth, so it is basically scarless. Even if it is one jaw, two jaws, or part of the jaw, all surgeries are done from within the mouth. Now in the surgery, once we have repositioned the jaw to its new desired position, we retain the new position by way of titanium plates and screws. Please be assured that the plates we use are of the best quality of titanium. They cause no allergic reaction, they cause no feeling when you're touching it, and nobody when they're looking at you will know that you have titanium hardware in your face. Most of the time, they are left untouched for your entire life. However, in very rare cases, they might get infected, in which case we do take them out. Now, once your surgery is done, what is your recovery period like, and what are the consequences of such a surgery? So, we usually discharge a patient in 1 to 2 days if you're otherwise seemingly fit. You are advised a very strict soft diet for up till about a month after this surgery, because we do not want any load or any mechanical load or pressure on our new position of the jaws. Exercise or any form of physical exertion is best avoided for at least a month after the surgery. You may be facing some level of swelling and discomfort lasting for about 2 to 3 weeks after the surgery. Some numbness in your lips and your cheeks can also be expected for this period of time. Most of the time it resolves within or up till 6 months from the surgery. The results of the surgery are best appreciated once all the swelling and discomfort has subsided, which may take up till 1 to 2 months. So after you are over with the initial phase of healing and the swelling has subsided, you will truly be able to appreciate the life-changing result of this corrective jaw surgery, which may even take 2 months. If this video has helped you understand whether you are a candidate of jaw surgery and whether this decision is something you will take to change your life and to change your facial appearance, do drop in a comment or DM us. For more related videos, please follow our channel and subscribe. Thank you.